to her work, Nicole is here to share her expertise and insights on the importance of speech therapy. So let's get started and learn more about how speech therapy can make a difference in our lives. Welcome to the show, Nicole.
Thank you for having me, Shavnan. It's awesome to be here.
Oh, fantastic. We're just going to get back to the show just now. Let's have a quick ad break and take a moment to relax and recharge while we dive deeper into the world of speech therapy with our guests. Stay with us.
Sister Shavina, can I ask you to come close a little bit to the microphone? Yeah, I'll raise it a little bit. Yeah, I think I should do the trick. Side.
Yes.
If you can come a little bit more to this side here. Yes. So you can speak directly into the mic. Should be all good. Doing well so far.
Both adults and children in the private hospital sector, helping them overcome communication. So, Nicole, tell me, what inspired you to become a speech therapist?
I've always loved people and I've always wanted to work with people. I didn't know what I wanted to do for the longest time, but I knew I wanted to do something with people. And I thought I'd wanted to be a teacher, but my path changed. And yeah, the Lord led me to speech therapy and I just love it. I get to work with people every day. I get to help them to see their potential. And it's just awesome. I love my job.
It's absolutely great. Can you explain what speech therapy entails and how it can benefit individuals?
Speech therapy is a really broad spectrum and people don't realize actually how much we do, but we work with newborns all the way up to geriatrics. We do feeding, we do communication, we do language, we do stuttering, we do voice, we do so much. And it's so awesome because you don't realize all of these things that people are struggling with. You don't think that we would help moms breastfeeding and we would help families communicate with their loved ones who have dementia, and helping people with strokes and traumatic brain injuries, and helping children to be able to speak to their parents. It's just such a privilege.
That's fantastic. When I think speech therapy, I think the alphabets A, B, C, and it
Yeah.
just comes together. So, what are some of the common communication disorders you work with?
So we work with a broad spectrum. So if we start with kids, we work with articulation errors. They can't say certain sounds. We work with that. We work with language disorders. We work with second language English speakers. We work with literacy disorders. Going into the adult population, we work with people who have had a traumatic brain injury, a stroke. We help them to regain their language, their speaking abilities. We work with older people who have dementia and they've kind of lost the ability to communicate their needs and wants. So we really work across a big broad span of disorders. Yeah.
So you spoke about variety, and if you can elaborate in terms of how would you assess and diagnose communication disorders with these patients?
So it varies according to the patient. So the first thing we always do is we assess their case history. So we ask them questions. How were you before this? What were if it's a child, what were your developmental milestones? At what age was your child walking? At what age did they say their first word? So we want to get a little bit of history from their medical history. If it's an adult, we want to know, did you have a stroke? Where was the stroke? How big was the stroke? We want to know all that information so we can assess properly. And then from there, we just do an assessment. So we'll assess asking questions. We'll see, are you able to follow instructions? Are you able to answer yes, no questions? We ask them questions to see how they respond. How is their sentence length? How are they communicating their needs and wants? How are they able to communicate if they don't like something, if they want something? How are they able to communicate with somebody else and within a conversation? And so we just ask these questions. We get our whole assessment done, and then from there we can get a diagnosis. But it does depend on the age, what is their diagnosis, and all of those things.
Okay. And how do you work with patients who have experienced trauma such as stroke or traumatic brain injury, possibly maybe an accident?
So the most important thing is to realize that whilst I see these patients every day, for this person, it's the first time that their family members had a stroke. I've spoken to a lot of people that have said, I was a normal person and I woke up one day and I can't walk and I can't talk. And so that's firstly the most important thing is realizing it's not a job, but you're actually helping people. Mm-hmm. And so you have to see the person as an individual and to realize that once you go from one person to the next, the assessment will change because every person is different. And so you can't go with a piece of paper and script and go exactly how it is according to the piece of paper because every person's different. And so it's really important that you go to that person, you see them as a person, and you also give them grace. I always say, it doesn't matter if you get things wrong in the assessment. Don't feel stressed because we just want to see exactly where you're functioning. So it just takes a bit of that pressure off. In a tested environment, you feel very overwhelmed and scared and anxious, and you don't actually perform the way that you should be. And so I always tell them, just be calm, just relax. If you get things wrong, it's okay. And we continue to work together through this journey.
And give me some examples of some of the common communication challenges patients might face.
So we see quite a few patients that have aphasia, which is a language fallout after a stroke. So they lose the ability to communicate their needs and wants. Sometimes they don't understand what instructions, or sometimes they understand exactly what we're saying, but they can't respond. So we see a lot of aphasia, and we also work quite a bit with an apraxia. An apraxia of speech is when the person understands exactly what you're saying, they know exactly how to respond, but the neural pathway from their brain to their mouth is a little bit dysfunctional. I always explain it like an electric line. It's like buzzing. And that connection is just a bit broken. And so they can't coordinate their muscles to speak, and they get very frustrated because they know what they want to say. They just can't move their mouth. Another common one we work with is something that we call dysarthria. And that's when you have some weakness in your muscle, your facial muscles, and your speech becomes very slurred. So it's very difficult sometimes to understand what the person's saying, and they get very frustrated because no one is able to understand what they're saying. So we work a lot with that on the adult sphere. In the childhood sphere, we work a lot with articulation disorders and phonological processing disorders. So they're a little bit unintelligible, and we're just trying to get that speech nice and intelligible again.
Well, my daytime job is obviously working in a rehabilitation setting, so I can obviously feel and share with you as well. We receive stroke patients and we see some of these symptoms. And is there any success stories working with your trauma patients that you'd like to share? Maybe something that probably would have really stood out for you?
can have a few that are coming to mind. I think I'll just share two. One of them, we had an older man, and his whole life he was a reverend. He was a pastor, and that was his job. His voice was his occupation. And he got very sick, and he had to have a trachea put in. That's where people breathe through your neck, and sometimes that can disrupt your voice. And so he had lost his voice, and he wasn't able to preach. He often married people, and he wasn't able to do that. And one of his goals with me was, I have a wedding in July. I need my voice back. And so we worked every day. And his wife had messaged me actually maybe 3 or 4 weeks ago, and she had told me his voice is so much better, and he's actually doing a wedding and his first preach since his injury. So that was really amazing. And yeah, just another story I want to share. We had a younger lady who had quite a big stroke. She had a brainstem stroke. And when she came into our facility, she wasn't eating, she wasn't talking, she was being fed through a TPN, which is through your veins. She wasn't even able to really say yes or no properly. She would sometimes say no when she meant yes. And so we worked really, really hard. One of her professional things, she worked in 2 spheres, but she was an opera singer. And that was her occupation. And so we worked really hard. And one of the sessions that actually brought tears to my eyes was we'd worked with her to start to communicate again. And we'd actually video called her mom. And for the first time since her injury, she was able to say to her mom that she loves her. And we had practiced that for 2 or 3 days before. And we pulled up the phone and she was like, I love you, mom. And her mom started crying because she hadn't heard her daughter's voice in months. And then we started to learn singing together, and she was able to sing. And I remember her being so emotional and just crying because she hadn't sung since her injury. And her voice sounded very different to how it was, but she was just so emotional to be able to sing again after she wasn't speaking for months. So that was really inspiring. And yeah, things like that just move you, and it makes you realize like we go there to do a job, but we're actually impacting people's lives. And it's such a blessing.
Such a blessing and very impactful. And I can hear your empathy and your care, concern, very heartwarming stories. And usually when I do my ward rounds, I normally see the patients with the trachea devices and the pegs, etc. And do you guys play a pivotal role in terms of the meals and assisting the team with obviously getting swallowing and eating correct?
Yes, so we work very closely with feeding, and we often always at breakfast and lunch with the patients. And we always assess, we're seeing what's happening. We're seeing, are they able to maintain their food when it's in their mouth, or do we have to strengthen those muscles so they can chew better? Do they have a safe swallow, or are they coughing? Are things going into their lungs? And so we give them a lot of strategies, and we really do work with them through the whole spectrum of their feeding. We had a patient that came in, and he had a peg, which is being fed through a tube in your stomach, and he had a very traumatic brain injury. With him, and we started on peg. We moved him to a pureed normal texture diet, eating like a champion. So we really do play a pivotal role in feeding, and it's teaching the carers, teaching family members how to feed appropriately, slow down pacing so that the patient is able to feed safely.
Let's take a short ad break, and well, basically I'd like to listen to Nishi right now, and we can enjoy this time. And when we get back, we can actually get back into conversation regarding the world of speech therapy. So listeners, stay tuned, and let's continue our discussion when we return.
लिया जब से मैंने ये नामे मुहम्मद, लिया जब से मैंने ये नामे मुहम्मद, बड़ा लुत्फ आया सवेरे सवेरे, इबादत का सौदा अंधेरे अंधेरे, इबादत का सौदा अंधेरे अंधेरे, मुनाफा कमाया सवेरे सवेरे, नमाज़ें शबो रोज सजदों पे सजदे किए जा इबादत का सौदा अंधेरे अंधेरे इबादत का सौदा अंधेरे अंधेरे मुनाफा कमाया सवेरे सवेरे लिया जब से मैंने ये नामे मुहम्मद लिया जब से मैंने ये नामे मुहम्मद बड़ा लुत्फ आया सवेरे सवेरे वो रोज़े का मंजर वो मेहराब मिंबर वो रोज़े का मंजर वो मेहराब मिंबर वो जन्नत की क्यारी बड़ी प्यारी प्यारी जहाँ पर लगी मेरे आका की तलियां जहाँ पर लगी मेरे आका की तलियां वो गलियां हमें भी घुमा जल्दी जल्दी लिया जब से मैंने ये नामे मुहम्मद लिया जब से मैंने ये नामे मुहम्मद बड़ा लुत्फ आया सवेरे सवेरे अगर कोई अपना भला चाहता है अगर कोई अपना भला चाहता है उसे चाहे जिसको खुदा चाहता है दुरूद उन पे भेजो सलाम उन पे भेजो दुरूद उन पे भेजो सलाम उन पे भेजो यही मोमिनों से खुदा चाहता है लिया जब से मैंने ये नामे मुहम्मद लिया जब से मैंने ये नामे मुहम्मद बड़ा लुत्फ आया सवेरे सवेरे लिया जब से मैंने ये नामे मुहम्मद लिया जब से मैंने
in Pietermaritzburg, a very cold Saturday. We're delighted to have joining us Nicole Picato, and she is enlightening us with conversations about speech therapy and getting to know about the world of communication and discovery. Nicole, welcome back to the show.
Thank you for having me. It's been really cool to be able to speak about speech therapy a bit and hopefully enlighten some people about what we do.
Absolutely. You've been very enlightful and as well educating the listeners on speech and the challenges. But we're going to dive in and get to know more about what you do. And let's hope that you're able to impart as much information to help the community. So, what is stuttering and how do you work with individuals that would stutter?
So, stuttering is a disfluent speech. So, we all stutter on a daily basis, but it's not a stuttering problem until it becomes very apparent in everything that we do. So, stuttering can be defined as various types of stuttering. You have a repetition stutter, which is getting stuck on the sound. So, it's saying the. You can get a block stutter, which is when they can't get the words out. So, they're like, or you can get a prolongation stutter, which is when they get stuck on a sound. So it's like the. So stuttering therapy will be very different for adults versus children, especially on the age. If it's a younger child, our approach is a little bit different because stuttering can affect your confidence and it can affect how you see yourself. And so we don't want it to become a situation where a child is so insecure about their speech that they stop speaking. And so we have to be very careful when we're working with younger children, our approach that we use. With adults, we start to shape their stuttering or their speech a bit differently. Stuttering, there's no cure for it, but we can give them compensatory strategies to reduce that stutter. Sometimes, especially older people, teenagers, adults, it really affects the way that they see themselves. And so they often have what we call these secondary behaviors. So they might twitch their head or twitch their eyes and try to avoid words because they know they're going to stutter on it. So we can also work very closely with psychologists and actually doing cognitive behavioral therapy just to help them with their confidence as well. And we do counsel them quite a bit as well. But yeah, so we work very differently with that person. It's depending, are they very insecure about their stutter, are they not? And then it changes how we would treat them. But yeah, the biggest thing with stuttering is that we want them to be confident. So sometimes we make them stutter on purpose so that when they do stutter, they can know how to pull out, how to stop that stutter, just to decrease that insecurity and anxiety a little bit.
Okay. And can you explain the different types of dysphagia, like swallowing disorders, and how they're treated?
So we have 3 different types of dysphagia. So the first kind of dysphagia we have is what we call an oral dysphagia. So that can be characterized everything orally. So it might be you have very, very weak muscles, so you're not able to chew properly, which can lead to prolonged meal times. Sometimes all the food can get stuck inside your cheeks. We call that pocketing. Sometimes food can be all stuck on your tongue and on your mouth. That's called residue. So we will target that with oral motor exercises and different textures. Maybe it's a bit difficult to drink something like a thin liquid, so we'll change the textures. Or maybe harder food or chewier food takes a really long time and they're not able to grind that appropriately. So we make those adaptations. The second type of dysphagia we have is what we call pharyngeal dysphagia. And so that's everything in your larynx, in your throat. So you have this special little muscle, and this muscle is a flap. We call it the epiglottis, and that protects your lungs. So every time we're about to swallow, that little flap goes and protects our lungs. But sometimes to that structure from a stroke or surgery or something like that, that mechanism can stop working or not work appropriately. So you might have a delayed swallow trigger and things start going into your lungs. So coughing and they begin eye tearing and their face goes red. And this can lead to very many complications like a pneumonia and aspiration pneumonia, chest infections. And so we will work very closely with those families as well and those patients. We can do x-rays. We call them modified barium swallows, and it's a video x-ray of how they're swallowing. We can see exactly where that food is going, and we give them some maneuvers. We change the pacing. We give them lots of different strategies to help that. And in very severe cases, we might have to advocate for enteral feeding, so things like pegs or nasogastric tubes for the interim, just so that they're safe. The last type of dysphagia we have is what we call an esophageal dysphagia. So that is when tumor, or you might have cancer of the esophagus, head and neck cancer, and it feels like something is stuck in that pipe and you're getting lots of heartburn and regurgitation. So as a speech therapist, we don't necessarily manage that. We diagnose it, but we would have to refer to an ENT, and then they would manage that patient further.
Okay. I know you spoke earlier about interactions with stroke patients. I also see at my environment that we do see patients coming in with autism or possibly dementia. And what is the communication strategies you might use with dealing with these patients effectively? Because definitely there must be some challenges to try and reach your goal.
Yes. So we'll start with autism. Autism is a very misunderstood diagnosis, and we work very closely with the parents in these cases. A lot of people, when you say autism, they think, oh, the kid is so smart and they can do math like so fast, they can do it without a calculator. But autism is really a spectrum, and we see kids on the whole spectrum. We see kids that are not able to speak at all versus kids that can speak, but they have significant social communication fallout. And so we work very closely with the parents. Again, treatment changes depending on the child. So we can do lots of different things. One of the things we can do is what we call AAC, which is augmentative and alternative communication. So we can give them a board, we can give them an iPad, and they can touch different icons that speak for them. So it's a very difficult diagnosis, autism. And one of the most difficult things for parents of autism or autistic children is these children really thrive in routine. And the minute we transition, so we're moving from home to the supermarket, the kids absolutely melt down and they panic because it's just not what they expected and they don't know how to self-regulate. And oftentimes parents will come to us and struggle and say, people don't understand that my child has this diagnosis and they think my child's being naughty and why am I not disciplining my child? Why is this child having a tantrum? But it's a meltdown. We call it a meltdown, and it's that they're just unable to calm themselves down. And so we work very, very closely with parents with children with autism, and we try to kind of train the parents how we can communicate better with our children. Sometimes we think communication is just speech, but communication can be nonverbal. It can be pointing, it can be eye contact, it can be a board. And so it's very vast. So we really work patient to patient. With our dementia patients, dementia is a diagnosis that is not curable as well. And we call it progressive. So it gets worse and worse. And so again, treatment changes depending on what stage of dementia that patient has. We work very closely with the family as well, and we work on maintaining their current communication and cognitive abilities. So while we can't fix or enhance that communication, we try to give them compensatory things. So we do a lot of communication partner training things, telling us when we're talking to our dementia patients, don't speak in long sentences, make it short, make it concise, so they're easy to follow. Use a lot of other means. Turn off distracting things. Turn off the TV. Turn off excessive background noise. Oftentimes, our patients with dementia will be confused and they won't know where they are. So we teach our families how to keep those family members calm and how we can reorientate them without being not cognizant of how they're feeling, because it can be very distressing if you think as a patient you're at home and somebody's telling you you're at the hospital. And so we teach them how to contain these patients and how to better communicate. So we mostly work with families because patients with dementia have memory problems. And so we can't teach them how to correct their communication because they're going to forget. And so our therapy really focuses on the family and their environment and how they can thrive in their environment by certain changes we can make.
That's wonderful. And with the world of medicine, everything's evolving. It's becoming robotic. There's center of excellence and streamlining of improving efficiencies. In your experience with speech therapy, do you use virtual apps, or is there anything that you can elaborate that might be technology driven? And I actually support research. I like to look at best practices, reducing costs, but still making the impact in healthcare. So does your team do research? Do you actually work with other provinces to see what speech therapy?
Yeah, so we do actually use apps. We often will download apps we use iPads at the hospital, and we will often download apps, memory apps, and we also have apps to do carryover at home. So we had a patient, she was also a young lady, and she had difficulties with her memory. And so we downloaded a virtual diary. We taught her how to use it and how to put everything that she needs, to-do lists, things that she needs to remember, conversations she had, feedback she got from the doctor. So technology is advancing, and so we do use it in our practice. And again, it's patient dependent. We wouldn't necessarily use a virtual diary with an 84-year-old man with dementia, because to teach him how to use it would just be a whole other difficulty. In terms of research, we do keep up to date with current research. It's very important. Research is ever changing, and therapy changes with our research. And so we do follow research. We subscribe to a few speech therapy resource pages, and they'll update research. We read research. We do what we call CPD, so continual education points. So we go on courses. We learn how to do new things when we stay current with the literature. We also will reach out to other people. If we've seen a case that maybe we haven't worked with before, we'll reach out to another colleague that might have worked with that, and we bounce ideas off of each other. So we try to give our patients the best evidence therapeutical practice that we can.
And you involve families into these therapy sessions, because I believe if you get the right support from the head start, that actually paints the patient's journey till the end to achieve better outcomes. Can you elaborate a little bit about that?
Yeah, patient family involvement is very, very important. So it's important with both our adults and our parents. So we do caregiver training and we do observation sessions actually at the hospital. And so we'll bring in those families and they'll sit for our 30-minute session, and we'll show them, this is how we're communicating. This is how we're targeting their memory. This is how we're targeting their speech. And we'll allow them to be the speech therapist and give them those skills that they need so that carryover can happen at home. Especially with our kids, we always say, I see my kids for 30 minutes once a week, but the parents and the teachers are seeing them all the time. And so it's important that we train those parents and train those teachers and train family members to work with these patience with these children so that carryover can happen. If it's just us doing it as speech therapists, the progress is going to be very, very slow, and it's not in the best interest of our patients. And so we believe family involvement is very, very important. We always give home programs to our family on discharge during therapy, and we're always open for families to message us and ask us how they can do things better. If they're struggling with something, what can they do better? So we believe family involvement is critical and important in patient rehabilitation.
You've heard that, listeners. Very informative, Nicole. We're going to actually take a quick ad break and we're going to connect just now. Stay with us. Stay tuned. We're going to speak all about what's happening behind the scenes with the world of speech and communication.
جئت لنا خاتما للمرسلين بدر الدجى رحمة للعالمين أبا الزهراء كم أشتاق لنلتقيه وأرى عينيك في الجنة تحت النخيل فيك الجمال والأمانة والوفاء عطر قد فاح نور عن مرض الآفاق سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله تزينت بك الأرض والسماء والقلب بات يهتف لك بالصلاة أحسن الناس سيد ومصطفى خير الورى صلى عليك الرحمن فيك الجمال والأمانة والوفاء عطر قد فاح نور عن مرض الآفاق
On 90.4 and 105.6 FM. I'm Shabnam Ismail, your host, and we've got a very informative speaker today from the world of speech therapy. It is Nicole Picato, and we're actually connecting with her to get to know about the discovery of the world of speech and medicine. Welcome back, Nicole, and it's great to have you on our show.
Thank you so much for having me.
That is wonderful. We're just going to dive straight back. Nicole is actually covering from the time that they receive a patient, the types of patients, and the scenarios and settings that they experience in getting a patient, get the communication in tune again. So we're going to cover some insightful information about how we can overcome those challenges. So tell me, Nicole, what is some of the most rewarding experiences you've had in your work as a speech therapist?
There's so many to count, but it's just so special when we receive feedback after our patients are discharged or from parents. And I had a parent message me the other day that said something along the lines of, no one has ever understood my child. No one has actually been able to help us the way that you guys have helped us. And we gave them a visual schedule. We helped change routines at home. And she said that it was just such a big difference. Just I get messages all the time from patients and saying, my husband is able to communicate or my wife is able to do this. And it's just so awesome. Having family meetings and chatting to the family and hearing their goals and working together with the family to reach those goals. It's really special. And it's a privilege to be able to work with people and just to be a small part of their journey.
Can you describe your experience working with interdisciplinary teams such as psychologists, occupational therapists to support your patients? And I'm sure you've got demands from your referral surgeons and neurologists that they want to know what's going on with my patient. Can you elaborate how you work together as a team?
Yeah, I believe holistic management is so important for the patient. If I was working in isolation as a speech therapist, I only see a portion of that patient. And I've seen so many advantages of working within an MDT. So, for example, if we have a patient who is aspirating, so everything that they're eating is going into their lungs, we work very closely with physio and we say, how is their chest looking? Or the patient really struggled with lunch today. Can you please do some chest physio? And it's very cool because we align our goals. If the occupational therapist is working on the right hand and they want them to be more independent in feeding, during our sessions, we'll focus on encouraging the patient to use their right hand to eat. It's very important to have a holistic understanding of that patient, from neurologist to psychologist. I mean, we deal with patients that have gone through a lot. And so sometimes things will come up in our session that we can pass on to the psychologist and she can target that in her session. It's really important to work as a whole and as a team because that's the most important for the patient. And we see the patient as a whole rather than a part. So our information informs how maybe the physios communicate with their patients or how the OTs communicate with the patients. It just gives us a better understanding of what they can do and what they can't do. And so our fields overlap all in some way. And so it's really important that we work together as a holistic unit in order for best patient outcomes.
And from the starting point of your interview, one thing I've actually gathered is that you got to have empathy, you got to have care, you got to have concern, but most of all, you got to have patience for your patients.
Yeah.
And what I'd like to know is if there is a learner student that would like to specialize in the field of speech therapy, what advice would you give them in terms of career choices?
I love my job and I would advocate for you join the profession. Our profession isn't really known about and sometimes a bit underappreciated. But if you are wanting to be a speech therapist, you just do need to have a few skills that are important. You need to be a good communicator. You're communicating with their parents, with their family members. You're talking to doctors. You're talking to other team members, the radiographers. You're speaking to so many people. So you do have to have very good communication skills. And I do believe you have to be very empathetic and you have to be able to connect with to be able to see the patient as a patient. And I think sometimes people who work in healthcare, they lose that empathy a bit. And to them, it's just a job and you wake up and it's just a job, but it's not just a job when you're working with people. And so you have to be able to see the person. And you also have to be creative as a speech therapist. It's not a textbook patient as this and you do this. It's very dynamic and it's changing. We can't treat every patient the same because everyone's human and everyone's different. And so you have to be creative in your therapy. Things change. Sometimes you'll plan a session for a kid and they don't like their activity. You got to think on your feet. You got to be creative. You got to change it up. So yeah, you have to be creative. You have to be very critically thinking. You have to be willing to be adaptable. You can't be so rigid in what you want to do because things change all the time. And so if you are seeking a career, those are a few skills I would encourage you to work on.
So you're giving the gift of life. You're also giving the gift of speech back to those patients that are obviously having those challenges. What are some of the most significant challenges you face as a speech therapist, and how do you overcome them? I mean, do you take some of your work personally, or you learn to shut down and create barriers?
Yeah, we see a lot of trauma, and some patients it's harder to deal with than other patients. And yeah, it's, as a human who is empathetic, we have cried a few times over our patients, but you need to be professional. You can't be crying in front of a patient. And it's very important that you don't bottle it all, and you do need to speak about it. And everyone knows how they cope with things differently. But my colleagues and I debrief every day. We had a patient, this is what happened, and we speak about it. You can't keep it all inside, and you can't just shut it down. And if you begin to shut it down, that's when you start to lose empathy. And that's when your patient care is going to decline a little bit. And so you need to know what triggers you, and you need to keep it professional, and you need to talk about it, whether that's with a friend, whether that's with a colleague, whether that's with a professional, whether that's with a mentor, somebody at church. Like, you need to be able to express it and speak about it, but obviously protecting patient confidentiality.
And it seems that you got so much going on. It's your patient, it's the environment. And how do you practice self-care? I know I spoke a little bit earlier when we were chatting personally about some of the hobbies that I have to incorporate so that I have a balance with my mental health, so that I'm able to cognitively go back into the medical environment and still give that level of quality care. So how do you manage your stress levels? And is there any tips you'd like to share with our listeners this morning?
Yeah, you do need to have something outside of work, and you do need to look after yourself so that you can look after others better. And so for me, I love people. I love my community. And so I love going out for a braai or watching a movie or watching the rugby together. For me, a big thing is my faith, and I go to church. I pray a lot. I'm in my Bible, and that for me keeps me grounded. And without the Lord, I would not be able to do what I do. He gives me the strength, and he gives me the compassion, and he helps me to see people the way he sees people. And so that's very important for me. I have my dog. I love hanging out with my dog, taking him for a walk. Just being in nature, just going on adventures like that really keeps me grounded. And if I don't put my emotional and mental health first, I won't be able to be the best therapist that I can be for my patients. And so prayer is a big thing for me, and my church community. They really help me. They keep me accountable. They pray with me, and it makes a big difference.
That's beautiful, listeners. Have a connection with your creator. Listen to your nasheeds as well. Make time for your salah. And it's been so pivotal that you got to put that in the center of your heart for everything that you do. And thank you, Nicole, for sharing your expertise and insights on the world of speech therapy with us today. And how can listeners get in touch with your team if they have to get in touch regarding their minor or their child or their family member?
So we are on social media, and you can find us on Google as well. You type in Tamlin Anderson Speech Therapy. We are based at a few schools. We are based at a hospital, and we do have our own offices. Our offices are on 38. You can contact us there. Our details are on our Instagram, or on our Facebook, and on Google as well. So you can find our contact details there.
To our listeners, I want to thank you for tuning into today. If you or someone you know could benefit from speech therapy, please don't hesitate to help. That's a wrap for today's show. Please be reminded we have our bookshop located at our Al Ansar, that is 240 Ottoman Road. There's Qurans in various translations, Hadith, kids Islamic storybooks and puzzles. There's also Zakah and Sadqa drop-off. We are open during the week as well on the weekend. Tune in to Al Ansar Peter Marisburg. And also remember, we have our Ashura Akni and Kitra distribution this coming Sunday, the 6th of July, inshallah, also at a venue at 240 Ottoman Road. It is at 12 o'clock, inshallah, so please bring your containers and connect with ourselves. Our presenters will be here, myself and the team. Jazakallah for joining us. I want to express my heartfelt gratitude to our technician MK, as well as Brother Asif in Durban, for your amazing support this morning to connect to our listeners. And to you, our team and our listeners, we thank you for engagement. And this is what makes our show so special. Until next time, stay healthy, stay happy, and keep shining. From myself, Shabnam Ismail, on the Peter Marisburg Pulse Show. Assalamu alaikum wa rahmatullah.
مولاي صل وسلم دائما أبدا على